M42 main stage here on day 4 at Arab Health. We are so excited to have you with us, and we're super excited about this next session. Not only is it vitally important, but the organizers behind this session, the very well-connected Dr. Fatima and the M42 team, have emphasized that this is the very first time that safeguarding is being given the spotlight at Arab Health. So that in itself deserves a big round of applause. Not only are we at the nexus of technology, sustainability and health, but we're at the nexus of being agenda setting and having the very best speakers with their expertise come on stage and share them with you. Now, we're going to make this session super interactive. Put your thinking hats on. Do be clued in, because we're going to open it up to audience questions very soon. Without further ado, allow me to introduce the speakers who will take you through safeguarding children in the UAE, current legislation and international best practice. We have Louise Cremonensi, who is from Safeguarding M42, the Senior Manager for Safeguarding M42. Please join me on stage. Fatima Shamlan, who's a clinical social worker and the first Emirati clinical social worker at Danat El Emirat Hospital for Women and Children. Over to you, ladies, to please take the stage and wow our audience. Thank you.
Thank you. So I think we're going to watch a very short clip first, just to set the scene for what we're about to talk to, because it's quite different from everything else that we've seen this week on the M42 stand.
Let's talk over some of the images. What are we looking at here? This is from UNICEF. I believe I was due to cue it up, so I'm glad that you were so impromptu you took over.
So I think before we start talking about the UAE legislation and the great work that we're doing across M42, it's really important to give context. For those of you who are not aware, when we look at the United Nations statistics for global safeguarding, what we find is that 1 billion children every year are victims of abuse. 1 billion children. Let me just leave that with you for a moment. That's 1 billion children who are abused, whether that be physical abuse, sexual abuse, emotional abuse, or neglect. That is almost half of the world's population of children. The world population is about 2.2 billion currently. So what we're saying is that almost half of our children across the world live with abuse. Now, to me, that's a rather horrifying number. And as healthcare professionals, one of our key requirements is to safeguard vulnerable populations. Yes, we provide healthcare and we ensure well-being, but it's also about keeping children and vulnerable adults safe. So we're now going to just talk a little bit about the federal law in the UAE and unpick that a little bit, and then we will go on to talk about the work of M42. So, Fatima, obviously, we have the Children's Rights Law that was implemented in 2016. Tell us a little bit about the motivation behind that and how it came to being.
The Child Rights Law of 2016 was introduced to UAE to be alongside with international standards and conventions, particularly in the United Nations Conventions of the rights of children. Now we have here the public and the federal law, number 3 of 2016. It's concerning the child rights, which is under the name of Wadima law. The name of Wadima law comes after the Emirati child who has been died after the torture of the father by her father and the stepmother. So it was a really big and a huge story in the UAE that need to stand up and shout for child rights. Wadima law enforce everyone in the UAE to provide the appropriate basic needs for children, healthcare, mandatory vaccines and all basic needs for educations, register them in the schools, essential other services and facilities that they needed without discrimination. Protection child or children UAE is must and needed for all over the society. Those who neglect children or abuse them mentally, physically, and emotionally will be under investigation, and cases will be protected by children protection sectors and social services. The ages of children that will be protected up to 18.
Thank you for that. I wonder if you could expand a little on how that law is enacted and the agencies that we work alongside to get to the good outcome.
Now, UAE is enforcing of the law relies on the community about children and multidisciplinary approach. We have three points here. The first one is the public awareness, education for all over the community and the society. We have the government agencies such as Ministry of Interior, Development of Community Department, Department of Development, Community Department, and Family Care Authority. All those agencies play a big role to implement and oversight the policy that related to children protection. Judicial systems play a big role where cases can be brought in the court and ensure all robust judicial process in place and all abusers or criminal abusive will be brought to justice. Collaboration with NGOs, non-government organizations, create a crucial relationship which may help us and provide us additional resources and services that advocacy with regard of protection children. That's an example of that, the UNICEF and United Nations.
Thank you very much for that. So now if we think we have a slight shift, we're talking about children who are at risk of abuse, but we also have another target group for our work, and these are women who suffer from domestic abuse. When we look at global figures, what we find is that 736 million women will suffer from abuse in their lifetime. That's 1 in 3 women across the globe. Domestic abuse can take many forms, from physical abuse, financial control, sexual abuse, coercive control. Not only is the woman a victim of that, but the children who live with that family. The effect of domestic abuse on children is catastrophic, which is why it's very important that we support victims. We must also remember that men can be victims of domestic abuse also, but from the statistics we know that that's very much an underreported problem for lots of different reasons.
So from the high number, Luis, how does the UAE legal system is addressing these issues of domestic violence?
So back in 2019, we saw the creation of the family violence law in the UAE. And what this does, very helpfully for us as practitioners, is it criminalizes domestic abuse. So crimes of domestic abuse are now punishable by imprisonment and fines. We also have special powers with the police to put protection orders in place, whether that be an emergency protection order or a planned protection order, which means that that perpetrator cannot gain access to that female. Part of that legal approach is also about family mediation. If possible, we want families to stay together. That is one of the pillars of UAE society. So often family therapists, psychotherapists can get involved. It's important to appreciate that a perpetrator of domestic abuse is not going to stop behaving that way unless they have significant help. So that's really important.
And the question of M42, is there any steps have been taken to safeguard vulnerable, Luis?
That's a really good question, and one that I'm delighted to share the answer. 3 years ago, I met with one of the senior directors, Teresa Quinn, and we talked about how this might look if we could get it up and running and embed a program of child protection. And this is what we've done. And one of the reasons that this has been successful is because we have had buy-in from our executive team. Without that, this would not have happened. So we are forever grateful for the executive support. We've done many things over the last 2 years, but probably the most crucial is to implement mandatory training for all of our front-facing staff. We've trained 5,000 staff so far. We still have a lot to go. We've introduced the M42 Safeguarding Handbook, which is a reference point for all of our clinical staff that has standard operating procedures, contacts, talks through what the signs you might be looking for in a domestic abuse case or a child abuse case, or indeed a vulnerable adult. We have a growing safeguarding team who are ever present across our clinical sites, but there is still much work to do. But again, you know, I don't want to plug M42 too much, but it's a huge thing that they've committed to, and we are the only semi-government sector healthcare provider who is mandating and have embedded safeguarding practice across all of our clinical areas. So it's definitely something to celebrate. So I think what I would really like to say in summary is that for any of you who are sat in the audience and you are delivering healthcare in the UAE, it's the law. It's federal law. You don't have an option. Your staff are mandated to report. If they don't report, they're breaking the law. And it really is as simple as that. Train your staff, upskill your workforce so that they can enact the law as it is intended in the UAE. Because the law is only useful if people listen and do the right thing. So as healthcare organizations, we all have that responsibility. M42 have taken it and run with it, and we're flying. But everybody needs to do the same. So thank you very much. Questions, lady? Any questions?
Hi, Louise. Thank you for that. It was very interesting. I'm just curious, sorry, there's a bit of interference. Organisations that haven't done this before,
Yeah.
how would you advise them to begin and where to begin?
I think the education is the first part of it, because in fact, I often get calls from some of our competitors to ask for support, and they'll say, oh, we need a bit of help with a policy or a flowchart. It's a much bigger piece of work. It's an education piece. And then, you know, we certainly work very closely with government agencies. We work with the ECA, we work with the FCA, so that we're all doing the same thing. So it's pulling and having conversations with key stakeholders, looking at what your workforce already know. What we found across M42 is that many of our practitioners had never done any safeguarding training because in many parts of the world it's not mandatory. So it's starting really with an analysis of your current situation, getting in there with the education, and then bringing those policies alongside. But I would say safeguarding doesn't create any revenue. And that's one of the main reasons that many of our colleagues in other healthcare organizations, they're not doing it because it's costly. But if you do safeguarding right, it will save you money in the longest term. And actually, all of that aside, we have a moral responsibility to do the right thing for the most vulnerable people in our society. Is it on?
Hello? So I have a question regarding safeguarding. Where do you see safeguarding down the line in the future of the UAE? What does that look like?
I think if, let's say, fast forward 5 years, and my view would be that in 5 years' time, every healthcare provider, whether you're a small clinic or a huge big organization with multiple sites, has a safeguarding team. They have clinical social workers like Fatma with loads of experience. They have policies. They have good relationships with the statutory agencies. We have a country-wide register of children who are at risk, and we talk to each other. We have systems that talk to each other. When we have fragmented systems across healthcare, across a country, it puts children at risk because families can go from one to the next and onwards without ever being picked up. So it's risky. So one unified system would be the dream.
Thank you.
Thank you.
I just have a comment to finish, and I'm going to steal a comment from our CEO, Hassan. Impactful disruption, and I think the work that you do is really impactfully disrupting. You're really looking after the most vulnerable, you're changing a mindset and you're changing a culture. And to you, Louise, Fatima, Khalood, Stuart, and all of our healthcare professionals who has embraced that cultural change, it's really well done. And you are really changing the country and the way we react to vulnerable people within it. Well done.
Thank you. Thank you.